Hello, I'm Dr. Beth Goethe.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Hi, we're here to talk to you a little bit today based on an interesting conversation that we had. A woman spoke to us and she said, "You need to do a video on 'He looks fine to me.'" And what she meant by that was the situation where a family member, a husband, wife, son, daughter, recognizes that something is going on with a person, but the person's regular physician or other people that are around say, "He looks fine to me. I don't know what you're talking about or what's the matter." And there are a few reasons that this happens.
Well, one of the big reasons is that even in dementia, the social skills, basic social skills, are not affected until much, much later. So someone can spend a few minutes with another person or a doctor or another family member and be able to carry on a conversation and sort of fill in and cover for their memory problems and look pretty normal. And if you take just that sample of time of the person's behavior, you would say, "It looks okay to me."
And especially if you're asking questions like, "Everything okay? Is your memory fine?" And they say yes,
Sure.
because they have limited insight into their problems. And we've talked about that a little bit before when we've talked about social skills. You've probably been in the situation at a party or something where you don't remember the person's name that you're talking to, but you manage to carry on a conversation and cover that for a while. You know, another reason that this can happen that I see perhaps more often than I even do the social skills issue is somebody that's already very intelligent, highly educated, so that the decrease in their function, because they were so highly functional to begin with, is not as obvious to a new person. So, you know, the doctor that they go to see may not realize the IQ that this person has and may not realize the depth of dysfunction that they're actually seeing.
Exactly. We call that cognitive reserve when someone is very, very bright and can go for a long time with dementia before you might pick it up on simple screening procedures. The doctor may ask them the date and some other information, and they're able to give that, and they're able to use higher level vocabulary and be
Even
able
reasoning.
and even reasoning, exactly. So the subtle or maybe to the family obvious changes in behavior and cognitive function aren't picked up on those, again, brief and simple screening kinds of measures.
Well, and the point that you brought up earlier, Beth, when somebody goes to see a physician, and if you're going in for a cold or your flu shot or an ache or pain or whatever, the physician is not looking for cognitive changes. If they're obvious, they'll make note of it. But it's very easy to get through a fairly quick physician's visit without that being even a problem. So if you notice trouble with a loved one, contact the physician and let them know, or go with your loved one to the appointment, or make an appointment specifically for that.
Right. And if you're embarrassed to talk in front of your loved one about their changes, you really should write that down and either give it to the nurse before the appointment as they're taking the blood pressure and those sorts of things, or to the doctor and make a note. And really, it's important that you're specific about the behavior changes you've seen. If you just say he seems different, or not doing as well.
Memory problems.
Very general kinds of things. The doctor is not going to be able to really interpret that and will need you to elaborate on it.
So, because the doctor may very well not have known your loved one before as you knew them. So the physician's going to have a hard time comparing. You need to tell them, what was it like before? What's it like now? In specific behavior, planning things, functioning independently, can't do checkbooks anymore, that kind of thing.
I don't think he's taking his medications. I don't think he or she is eating
right
consistently, and this is a big change. Or she's been complaining of being up all night and not sleeping. Specific kinds of things that will help the doctor figure out what to do next.
Doctors don't like to miss things, but we've told you before that in many ways, you in this audience are more educated about some of the finer and more subtle changes that happen with dementia than many physicians are. You know, I'm a geriatric psychiatrist. Please do not ask me to set a broken leg. That's not my area of expertise. We specialize in the areas that we specialize in because that's where our areas of interest are, and we focus on that. And you can't expect every physician to be as focused on dementia as some subspecialists are. So help educate your physician. Don't assume that the doctor knows everything. They know a lot with the information that you give them because you're giving them the symptoms that they can make sense of. And that way you can work it as a team because it just can't be done by one person. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.